Hi there. If you are a woman in your 50s and you have been told that your LDL cholesterol is normal and therefore you're fine, then this message is for you. For decades, we have considered LDL cholesterol as the main predictor of heart attack and strokes, but that is not the case anymore. What really drives cardiovascular risk is the number of atherogenic particles in our blood, not the total amount of cholesterol that we have. And that is why other markers are more important than LDL alone in predicting cardiovascular risk. These markers include apolipoprotein B or ApoB, non-HDL cholesterol, and the triglyceride to HDL ratio. ApoB reflects the total amount of atherogenic particles that are in your blood hitting the vessel wall and causing damage. And these particles, especially the smaller particles, are going to enter the arterial wall, trigger inflammation, and start the process of producing plaque or atherosclerosis. ApoB has been shown to be causal of atherosclerosis. Non-HDL cholesterol includes LDL and other atherogenic particles as well. And the triglyceride to HDL ratio is a marker of insulin resistance, which is also highly predictive of cardiovascular risk. So what happens in menopause? In menopause, our ovaries stop functioning. We don't produce estradiol anymore, and estradiol has a protective effect on the endothelium, which is that inner lining of your blood vessel wall. So when we no longer have estradiol, the endothelium becomes very vulnerable. There is less nitric oxide production, which is important for vasodilation and for perfusion of your tissues. There is increase in inflammation, and the small atherogenic particles can more easily penetrate the arterial wall. Another thing that happens with lack of estradiol is that our blood vessel walls become stiffer, and that leads to hypertension or high blood pressure. And it's important to note that in women over 50, hypertension is the most important modifiable risk factor for cardiovascular disease. So if you have a normal LDL, but your ApoB is elevated, your triglycerides are also elevated, your HDL is low, and you have markers of insulin resistance, that increases your cardiovascular risk. If your provider is only checking your LDL level to tell you that you are okay, you need to be asking better questions.